Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What causes a purple finger? A finger typically turns purple when blood is not circulating well to the hand. /r/n/r/n Blood is bright red when it is moving the proper amount of oxygen through the body. Without an adequate amount of oxygen, blood turns dark and color alterations follow, including a change to a purple tone. /r/n/r/n There are a few reasons why this may happen, as well as additional reasons your fingers could turn purple. /r/n/r/n This article talks about some of the more common health conditions that can cause a purple finger. It also explains how they are treated and when it's a good idea to see your healthcare provider. /r/n/r/n/Verywell, Jessica OlahrnrnWhen When a purple finger occurs, it is a sign that you are not getting enough oxygenated blood to that, or perhaps another, area of the body. If it persists, especially after warming the hands, or if it appears with other concerning symptoms, seek a medical evaluation. /r/n/r/n A vasospasm is due to a persistent contraction of the blood vessels known as vasoconstriction. This causes the arteries to narrow, which reduces blood flow. /r/n/r/n Vasospasms can occur in any part of the body. When this happens in the arms or legs, the symptoms include /r/n/r/n Vasospasm treatment for the fingers focuses on preventing any causes of vascular constriction. It includes /r/n/r/n Raynauds syndrome, also called Raynauds phenomenon, is a disorder that affects your blood vessels and causes them to overreact to cold weather. It affects more women than men. /r/n/r/n When a person with Raynauds syndrome has an episode, the body doesn't send enough blood to the hands and feet. In severe attacks, fingers can turn blue or purple because of decreased blood flow and lack of oxygen. /r/n/r/n Both stress and cold weather can lead to an attack. When this happens, the hands and feet can feel very cold or numb. An episode can last only a few minutes to more than an hour. Symptoms range in severity, but they are most often mild. /r/n/r/n There are two forms of this condition. /r/n/r/n There is no cure for Raynauds syndrome. Lifestyle changes and medications can reduce the severity and number of attacks, both in primary and secondary cases. They also may prevent finger or toe tissue loss. /r/n/r/n Lifestyle changes /r/n/r/n There are steps you can take to avoid or limit Raynauds episodes. /r/n/r/n Medications and surgeries. /r/n/r/n Vasodilators, which widen the blood vessels, are the drugs most often used to treat Raynauds. /r/n/r/n Firstline treatment usually involves calcium channel blockers such as Procardia, nifedipine. Minipress, prazosin, is a high blood pressure drug sometimes prescribed for people with Raynauds. /r/n/r/n Surgery may be needed in severe cases to restore blood flow to the affected areas. /r/n/r/n Achenbach syndrome can cause purple fingers. People with this rare condition have occasional pain and swelling in one or more fingers, the precise cause is unknown. Fortunately, although Achenbach syndrome causes discomfort, it is not dangerous. /r/n/r/n A hematoma, a bruise with the blood pooling outside of broken blood vessels, will follow. This causes the color change in the affected finger. There are often warning signs a few minutes before the color change begins, including pain, tingling, and itching. /r/n/r/n Bleeding beneath the skin typically stops spontaneously, or after applying pressure to the affected finger. The abnormal purple color usually resolves without treatment within 3 to 7 days, leaving no permanent damage. /r/n/r/n Chilblains is a rare, painful condition that causes red or purple bumps or patches on the fingers. It may also occur on the toes and, less commonly, the cheeks and ears. These bumps may burn or itch intensely and may become swollen or blister. /r/n/r/n chilblains is a weather-related disorder caused by blood vessels that don't react normally after exposure to cold and damp. Symptoms usually appear a few hours after exposure. /r/n/r/n chilblains mostly affects women, though the reasons for this are unknown. /r/n/r/n because cold temperatures trigger chilblains. It can be prevented by keeping hands or other affected areas dry and warm. Additionally, keeping up core body temperature and not smoking are also helpful. /r/n/r/n These steps are usually enough to keep chilblains under control. If not, a healthcare provider can prescribe Procardia XL, nifedipine, or pentoxyphylline, drugs that work to improve blood flow. /r/n/r/n Buerger's disease normally affects the small and medium-sized nerves, arteries, and veins. It causes blood vessels to swell and narrow, which constricts blood flow. This puts you at risk for blood clots that affect the hands and feet. /r/n/r/n One of the symptoms of Buerger's disease is decreased blood flow to fingers and toes in cold weather, which can lead to a purple or blue finger. /r/n/r/n Other symptoms include, /r/n/r/n Healthcare providers aren't sure what causes Buerger's disease. Smoking is a common thread among people who have it. /r/n/r/n There is no cure for Buerger's disease, but symptoms are often reduced or resolved when someone quits smoking. It is the most effective treatment to stem the effects of the disease. /r/n/r/n People with Buerger's disease who continue to smoke have a 40% to 50% amputation rate. /r/n/r/n Other treatments that have been used with varying success include, /r/n/r/n Your finger can turn purple or blue for reasons that don't involve any physical injury. A few of these causes, such as vasospasm, Raynauds syndrome, or chilblains, have weather-related symptoms. It's important to avoid the cold, or dress carefully for it, if you have any of these conditions. /r/n/r/n Other reasons may be related to an underlying health issue. In some cases, there can be serious consequences if the condition is not diagnosed and treated properly. /r/n/r/n It usually takes about 3 days for a burst blood vessel in the finger to heal. /r/n/r/n There are no specific tests for Achenbach syndrome. The diagnosis is based on a physical exam and a person's symptoms. Doctors will rule out other possible causes during the diagnostic process. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.